Now that we have social prescribing on board in the last few years, it greatly has reduced the demand on our services because they have that contact and support system from their link worker with the social prescriber.
We find that it's much easier to discharge people because we've something to discharge people to. And of course, that's going to stop people being re-referred. So while somebody may have, been attending the service for a longer period before, now we can look maybe 6 months, even 12 months before that to say, okay, let's get this discharge planning in progress, referral to social prescribing, and that can really speed up the process.
What you often find, though, is that there is a reduction in the number of crisis assessments because as people become more involved in the community, they have more supports and therefore they find it a bit easier. In the longer term, though, reintegrating people into community supports will have an impact on the number of times we need to see them in the clinic.
We would notice that there isn't as much as a demand on the OT services because the people are engaging in the services that they really need. Are their goals or their intervention may be met by ourselves, and we've sent the necessary onward referrals to the services that they need.
So I could look up things and try and gather information from different sources, but when there's a one-stop person who's all that information, it's so easy to be able to say, if you speak to Tony, he'll be able to tell you exactly where to go, rather than me offering snippets of information or second or third hand information.
It has lessened some of the repeat referrals coming into our service for people who have maybe been seen already and their goals and interventions have been met, but they remember us from seeing them in their home and they make contact with us again. So we're able to delegate or refer them on to the certain services, which lessens our load as OTs and opens up a wider range of services that are available to them.
Their routine changes, they're involved in more activities, they're happier in themselves, their confidence is built, and all that kind of impacts on, there'll be shorter appointments than the next time.
Very often if people are doing better, well then the resources are freed up to help those who are perhaps more critically ill at any given time. We will still see our patients routinely and still have the therapeutic interventions that we always would have done, but this provides an enhanced quality of life for the patient and also with a view to improving their interaction with the community at large, and as a consequence they will then do better.